Well, good evening. My name is Charles Patton, and I am here representing Tacts, the Association of Clinical Trial Services. And I just want to thank you all for tuning in today. We will be discussing, once again, health equities equals black unity. And what I really want to focus on, as I stated last month, for those that was listening, that I focus primarily on substance abuse. But when we're talking about health equities, it's not just a one-dimensional problem. You know, health equities includes all things as far as some of our basic needs: food, clothing, and shelter. Okay? So my focus today will be talking about pain management. We know that, as I stated before, that we are in a heroin epidemic. And now what we're starting to see is that it's affecting all counties, particularly here in Illinois. You know, I've been working in the substance abuse field for over 20 plus years, and we're starting to see a shift in the populations that are coming into our program seeking treatment for opiate addiction. And in talking with some of the particular individuals that are suffering from this particular disease, a lot of them start out primarily because they've been prescribed some pain medication for some injury or illness or some chronic condition. And subsequently, once the prescriptions run out, then they wind up using some of the street drugs, which we know as heroin, or some of the unprescribed Xanaxes or the other painkillers or pain managers. So what we want to start to look at is how we can make some healthy decisions around managing pain. You know, I know that as we age, and I'm not dating myself, but as we age, we start to experience certain things. Our bodies doesn't respond the way that they used to. For those people that are dealing with some other chronic illnesses or some hereditary conditions, they find themselves being prescribed these particular medications, and at some point they find themselves, at least some of them find themselves in a condition where they can't stop taking them. So what we want to do is talk about some healthy strategies to manage some pain. But before I get into that, as I stated, my name is Charles Patton, and you all can refer to me now as what I like to think of as the PC, the People's Counselor. All right, so I will be working with and continue to work with the community to come up with some healthy strategies, because as I mentioned before, health equities is not just a one-dimensional problem. I want to applaud some of the recent developments in some of the communities where we've been addressing what we call food deserts, which is a big part of the health equities paradigm. Because if you can't get healthy food, then of course your body will suffer. And if you're not eating, and I know we done all seen those particular horrific commercials for people in some of the third world countries where their bellies is extended. They just look to be in very, dire shape. So we know that not having access to healthy foods can also cause a problem with having some health equity. But we just recently had a couple of stores. I don't want to make a commercial out of it, but I was happy to see that the municipality or the government here in Chicago is starting to try to do some things to address these so-called food deserts. You know, so that's one step in the right direction. Then, of course, having access to adequate health care. You know, I mentioned on the last show last month that we were dealing with some of the backlash from the Affordable Care Act. And in recent reports, even though they have been, charged with providing access to care for everybody, providing insurance to everybody, the access to care is still being somewhat limited and monitored. So we as a community have to start to step up and start to push and advocate that they make these particular services available to all groups and all people that are qualified for them, and not try to regulate what they're going to pay for. If you need it, then they should pay for it. If it's been justified by the medical community, the treatment community, or any other organization that's been charged with assessing and diagnosing certain conditions, then the insurance company should not be able to regulate what type of treatment you're going to receive. I read a report from one of the CDC prints that stated that it would be horrendous if a insurance company had to have a heart patient, or somebody who was having a serious chronic condition, and had them to be weaned off of their medication like some of them are doing with the opiate dependent or the addicted client. They are making it where they won't pay for continued care, but they will dictate that you can get 1 week or 2 weeks as opposed to what's been assessed that's necessary. When I first got into this particular business in the treatment arena, treatment was anywhere from 12 to 36 months. Those that are familiar with some of the gateway philosophies and some of the other old models of treatment, those particular programs were effective from what my experiences have been. Now we are dealing with some of the brief therapy models, and don't get me wrong, I'm not saying that they're all bad, but what I'm saying is that people should be able to get the care they need for as long as they need it, and it shouldn't be regulated by somebody who's manipulating purse strings for profit. So that's going to take a community uprising and a community voice. So once we see those things, particularly with our loved ones and family members, and I know some of the listeners out there have experienced or know someone who has experienced what I'm talking about. So I want to make sure that I get you guys charged up, because if we don't do it, nobody will. Once again, health equities require a lot of things. It's not just about, as I mentioned, the food desert. It's not just about the physical aspect of it, but then we got to look at some of the other emotional aspects that people are dealing with. There's also another scourge on the community that we are suffering from as a people, and that is mental illness. Ooh, people don't want to talk about mental illness because it's a taboo subject, as with some of the other conditions like HIV. Nobody wants to talk about certain things. But if we don't bring it to the forefront, then it will never get addressed. I'm from the old school, and it was my teaching or induction that the squeaky wheel will get the oil. So we need to start raising our voice and squeaking a little bit more, okay? So that we can start to make sure that all of these policies that's put in place that is supposed to be for our advantage is just that, for our advantage, and not being limited or cut off, where we can't get in to get the tests we need. I know a lot of people, if you've been paying attention to some of the news segments, that they had a issue with some of the VA programs, where they had separate lists, where people on this list could get in, but people on this list couldn't, and then we have programs where, the funding is being cut for whatever reason, so they had to limit their amount of people they can serve, or you have to call and go through the bureaucracy of dealing with some of these insurance companies that say, well, based on our interpretation of the information, they can only get 6 days, or they'll get 14 days, when in actuality they may need 30 days or 60 days, given some of the other issues that's going on. Because we know that it's, like I said, it's not just a one-dimensional problem. I see people all the time that come in that's malnourished, that's homeless, that's not adequately clothed and not adequately educated, so of course they suffer from a lot of conditions. And then we have a lot of people, as I mentioned a moment ago, that's suffering from mental illness that's not being diagnosed. And if you're paying attention, we notice that a lot of the mental health facilities, some of the local board of health facilities are no longer in existence, So we have to really start to advocate for ourselves, because when it's all said and done, we are the authority on what's going on with us. Okay? So we definitely have to start to, as they say in the program I'm familiar with, to be aware is to be alive. And if you don't advocate for yourself, who else is going to do it better? So let's start to talk a little bit about some of the other practices that's going on. I know with, like I said, I'm a substance abuse counselor by trade. You can refer to me as the PC. I mentioned that earlier, the People's Counselor. And right now, we are looking at addressing some of the pain issues that a lot of us are suffering from. I myself deal with some chronic pain, but generally, I can manage mine with, doing some stretching exercises, and try to stay away from some of the medication, that causes some of the addictive problems that we see a lot of people suffering from. But they also have some other techniques that you can employ, and I would encourage you to do the research, because massage is a good technique. Using ice packs, using some of the other like I say, stretching exercises, or the Pilates, if you will. I was watching a segment on a health show the other day. I think it was called Medical Watch. And they were talking about actually doing a study around doing some crawl therapy, where we can get back to the basics like we was when we was a little baby. And that kind of helps us to get our body back into alignment. And subsequently, it can start to alleviate some of the pain naturally. But it's our best interest to start to look for these other techniques and not rely on something that comes out of a bottle or a factory to make us feel better. Okay? So that's just one aspect of dealing with some of the health equities that we need to kind of get balanced. And when you talk about some of the other conditions, as far as the housing, there are some things that we can do around the legislation. If you don't know who your aldermen are, if you don't know who your senators are, then I encourage you, I employ you to find out who these people are, because you are the reason they got a job. They are considered public servants. So it's important that we make sure that people that's supposed to represent us do the best job that we think they can do. And if they don't, then we have an election coming up for certain groups of people, and we need to exercise our right to get them voted out or in based on what we feel that's being done in our best interest. And that's how things are done in this country. Of course, I'm an advocate for, that you seek your own wellness, you seek your own happiness, and of course, I try to pay close attention to what's going on with me, around me, so that I can be an instrument of trying to affect some positive change in what's going on. We need to start to get the information as much as possible, because for those of us that ascribe to the greatest story ever told, it says in the book that my people perish for a lack of knowledge. Okay, so we know that knowledge is a very important factor when it comes to making good decisions. And that's been my motto for the last 20 plus years, to make good decisions. So that I can get or affect the best outcome possible for myself, as well as for those I come in contact with, particularly my family, my friends, and the community, the neighbors that I live close to and that I work with. We need to make sure that we access as much information as possible, and then, as they say, discern discern the information. From my understanding and my teachings, you got to cite at least 3 sources that's saying the same thing before it can move from theory to fact. So if you hear some information, then go and follow up and do the research. I would encourage us, each and every one of us, to take an active role in that. Because it's imperative that we learn how to take care of ourselves first and foremost. I believe in physicians, because I talk to mine regularly, but I know that he's not the authority on what's going on with me. Now, they can run some tests and see some things that I can't see. But when it comes to feeling certain things or experiencing certain ailments or conditions, or when things ain't working right, I know that first. So it's up to me to let them know what's going on with me. And then at that point, then we can sit down and negotiate and talk about what can be done. There's sometimes that they may want to use a procedure that you don't necessarily agree with. And it's in your best interest to let them know that. Sometimes they may prescribe some medication that you don't necessarily agree with. You don't have to take it because they say take it. So that's part of health equity. Getting the things you need so that you can have optimal health. We need to make sure that we become the authority on what's going on with us. And it's not about academics. It's not about your level of education. It's truly about you being aware of what's going on with you. Okay? I know I like to talk to some of the young people, and of course you all that's in the community know we've been dealing with a lot of unnecessary violence. And once again, this kind of ties into what I believe has something to do with these undiagnosed mental conditions, and of course the literature states that poverty is one of the major conditions that a lot of people, particularly people of color, are dealing with that kind of keep that health equity from balancing out. Poverty has some very negative consequences for those of us that's been suffering with it and dealing with it for a long time. When it comes to, like I say, not having the adequate or the basic needs, that causes a lot of stress, a lot of unnecessary hardship for yourself as an individual, as well as for your families, your children, and of course, if we're not dealing with the particular stress part of it, or the particular lack of education, and we can't get into the necessary tools, or we can't have the appropriate conversations with the people that we need to, then at that time we have to learn how to reach out and start to ask some of the questions. If we are having some difficulty articulating or expressing ourselves, which I found that a lot of young people do, at times they have some difficulty, when it comes to filling out applications, when it comes to sitting down talking to a potential employer, even having conversations with their physicians and doctors, for those that have primary care physicians. They find it difficult to talk to them. I've had a couple of clients who were literally terrified to go to the public aid office and ask for what they need, even though that particular service was there for them. So this is just something that I would like to share with you, and hopefully get you to thinking about some of the things that you can do as an individual, so that we can start to free ourselves from some of these conditions that we're suffering from. Okay, because it is truly up to us to make the difference. And that's been my motto as well. Each and every day, I want to try to make a difference. And I try to read everything I get my hands on. Some of it pans out, some of it doesn't. But like I said, we have to be willing to do the due diligence. We have to be willing to make a concerted effort to sort out some information. So I just want to kind of share with you a couple of slides because I am actually representing your community epidemiologist, Sister Yah, who will be in shortly to kind of close this segment out on some of the other important things that we need to do around health equities. So thank you for listening to me, and hopefully I will get a chance to talk to some of you all personally so that we can start to formulate a strategy on how to balance some of these health issues that we're dealing with, particularly for people of color. Okay? If you have any questions, you can reach us at the number, hold on one second. Let's see. You can reach us at 312-961-6189. This is Tacts, the Association for Clinical Trial Services, and we will gladly share with you what strategies and techniques that we have, and hopefully we can come together and make a difference and truly have an health equity forum that can create some Black unity. So please give us a call at your convenience. And once again, I want to thank you guys for tuning in, and I will look forward to working with you. Okay, I will look forward to working with you in any setting. So once again, you can reach us at 312-961-6189, and this is Tacts, the Association of Clinical Trial Services, and I am your PC, the People's Counselor. So you can refer to me as the PC. And my name is Charles Patton, and I am looking forward to helping us to develop some effective strategies that will address this health equities. And if you have any concerns about pain management in this heroin epidemic that we are experiencing, you can also call 773-988-3411, and that will get to me directly, and I will be willing to assist you in trying to navigate through some of the bureaucracy that we've been encountering in getting people into treatment, and of course addressing some of these issues. But once again, you have to be proactive. You have to be the one to let us know what's going on with you, and then we collectively can try to work on solving that problem. So once again, I want to thank you all for tuning in. And we will continue to do this every month. We're here on the third Wednesday of every month, starting at 5:30. And we will be addressing health equities. This is a call-in live show. So do feel free to call in. And if you got some questions, we will try to answer them. If we can't answer them, then we will definitely try to point you in the right direction. And once again, like I said, I'm a literature buff, and I'll read anything that I can get my hands on that will help us to address, some of these issues. And we know that there's been a lot of things put in place that's supposed to be for our best interest. But if you don't read the fine print, you can wind up finding yourself in a world of trouble and don't know how you got there. But that's why collectively we can make a difference. I've been told that 2 heads is a little bit better than one. And a person that counsels themselves is a fool. So truly reach out and get the necessary help and conditioning and the assistance that you need so we can change this condition that our people are suffering from. So I thank you. And please tune in next month.